Good day, ma'am. I am Ageline Reyes, your student nurse from Pamantasan ng Lungsod ng Marikina, and I will be going to demonstrate to you a preparation of medication from vials. But before that, you need to verify the doctor's order and then perform hand washing technique before doing any procedure to avoid contamination to the medication of your patient and to prevent the spreading of microorganisms. And then next is you need to check the 5 rights of the medication, which are the right time, right dose, right medication, right route, and then the right patient. Next is you need to inspect the bottle of the medication, check the expiration date, and then inspect if there is a crack or if it is broken. Just return it to the pharmacist and or just discard it. And then next is gather all things that you will be needing, like syringe, needle, and the vials. And lastly, the cotton with alcohol. And then if you are using a powdered form medication from vials, you need to add distilled water. For example, take a syringe and then add 3 cc air or the prescribed quantity amount needed for medication. For example, 3 cc, just add it on the syringe, and then by gently pulling the plunger of the syringe, and then remove the original needle of the syringe, and then replace or attach the aspiration needle, and then inject the air to the distilled water bottle. And next is withdraw the distilled water bottle, and then you need to inject the distilled water to the vials, and place the vials in between of your two palms, and then mix the diluent and the powder by rolling it thoroughly. Don't shake it. So now we will proceed on the liquid form of the medication of the vials. So if you were using a liquid form, just uncap the vials and then discard the cup to the sharp container, and then take a syringe and then add 3 cc or the prescribed quantity amount needed for medication, and then remove the original needle of the syringe and attach the aspiration needle. And then uncap the needle or the aspiration needle, and then inject. But before that, you need to wipe the top of the bottle of the vials by using a alcohol swab or the cotton with alcohol to prevent contamination to the medication. And then now we can inject the air to the vials, and then withdraw the medication. and then discard, if the bottle is empty, just discard it on the sharp container, and then cup the needle or the aspiration needle, and then turn it upright, and then remove the aspiration needle, and then you need to dispose it or discard it by throwing to the sharp container. Next is you need to remove all the bubbles to the syringe by tapping the syringe, and then when the bubbles get out, you need to remove the air to the syringe by pushing the syringe or the plunger of the syringe, and then you can now attach the original needle. And then after that, you need to label the syringe, if what medication it is, and then for whom. And you need to aftercare all the materials that you have used, and then perform hand washing technique again, and document all the data or all the procedure that you have done.